Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Diane Van Dusen and Kelly Owens from the Eddy Alzheimer Services. Welcome to the show, ladies.
Thanks,
you.
Peggy.
Diane, let's start with you. What do you do for Eddy Alzheimer Services?
Eddy Alzheimer Services, I'm manager of clinical dementia services, and my main focus is our ADAC clinic, our Alzheimer's Disease Assistance Center. I manage that, and I do some education. I run support groups. I'm a social worker.
Okay. And we wanted to mention where the funding originates from your program.
Well, for ADAC is a program that was set up by the Department of Health, and our funding comes from New York State through a grant. And
Okay.
we also have other grants, but that's the primary. Albany County is a funder for some of our programs.
Well, thanks to them.
Yes.
Okay, Kelly, what do you do for Eddy Alzheimer Services? And can you give a quick kind of breakdown on the relationship between the Eddy and Northeast Health?
Sure. I'm the coordinator for Eddy Alzheimer Services, basically coordinating all the support and education programs for caregivers and individuals with dementia. Northeast Health is a regional not-for-profit providing comprehensive health care services, community services, as well as supportive living. The Eddy is part of Northeast Health and provides a focus on senior care issues, chronic care, long-term care, retirement living, as well as community service programs.
Wow, that's a lot, isn't it?
It is. It is.
Okay, Diane, you're going to do the Dementia 101. Can you give basically a summary of what dementia is?
Dementia is a syndrome. It's caused by many different diseases, Alzheimer's disease being the most common, accounting for 60 to 70% of dementias,
Okay.
most of which are irreversible.
Okay.
Most dementias are.
Now, what is the incidence rate in New York State? I read that it's something like 370,000 people diagnosed.
That's correct. Nationally, right now, you're looking at around 5 million people who are diagnosed with dementia, and that's projected to increase to 16 million by 2020.
Now, what would be the reason for that to increase so much within a few years?
Well, the aging population. The greatest risk factor for Alzheimer's disease is actually growing older.
Okay.
And with our population, our baby boomers are all entering that time, and so they are predicting it will increase considerably.
Okay. And I also read on your website that it was 24,000 suffering from dementia in the capital region.
Yes,
So that's a significant number, too.
it is.
Wow.
It is.
Okay, so what are the symptoms at onset?
Most usual symptom of onset is memory loss. Short-term memory loss first, but you might also see personality changes. You might see difficulty with social functioning, with a person wanting to back away from groups, and also activities that they've previously enjoyed. That's generally, you would see that in the beginning.
But kind of losing your keys or forgetting where something is kind of a normal thing when you're older. But
exactly.
What's the difference between dementia and...
Well, everyone
Normal memory
has
loss.
lapses in memory. That's just a part of somewhere around 40 we start to realize that. So we're all experiencing that.
Yeah.
Losing your keys occasionally, driving away with a cup of coffee on the hood of your car. This is stuff
think I've
people
done
do.
that.
Probably have. But when you're younger, you're not so concerned. Older people are really worried about these little lapses of memories. If you forget where you put your car keys every now and then, not such a big deal. If you forget what to do with your car keys, much bigger deal.
Yes, of course. Okay, you mentioned there were other conditions. You said Alzheimer's causes 70% of dementia?
60 to 70% of dementias, followed closely by vascular dementia, which would be someone having what's called mini strokes.
Oh.
And so that's the next most common kind. Parkinson's disease is another
Right.
common disease of older people, and there's many, many others far beyond what we'd be naming here, but the most common cause that people would see would most likely be Alzheimer's.
Now, there is also a number of medications that people can take that really cloud their thinking and everything, but, there is a big
Absolutely.
difference between those two things, right?
There's so many other causes of memory loss that you would want to explore before you come to a diagnosis
Right.
of Alzheimer's disease. Vitamin B12 deficiency, multiple medications, as you mentioned, is probably the most common cause of
Right.
clouding thinking are the
Interactions,
medications.
yeah.
Thyroid problems, infections. And so there's many causes that reasons that people can have for having memory problems,
Right.
and they should always, first step is to consult their primary care physician.
Now, I'm imagining that the diagnosis process would be complicated.
It is
Who would
complicated.
actually do the diagnosis? What kind of specialty do they have?
Geriatricians do the diagnosis, neurologists do the diagnosis. Many primary care doctors are very capable of diagnosing dementia. It's difficult, even for the experts, in the early stages of the disease, and it requires a full process of ruling out other disorders. It may require radiology. And so it is difficult, especially early on, because their symptoms are so similar to things you might see in depression or other conditions, other medical
Can that be
conditions.
seen like on a CAT scan?
No.
Or?
No, Alzheimer's can't currently be seen on a CAT scan or an MRI. There's some findings that are consistent with Alzheimer's. What you do with a CAT scan or an MRI are rule out other conditions like stroke. Strokes can show up on
Right.
a CAT scan or an MRI. Blood clots,
Right.
brain tumors. So a normal CAT scan in the presence of symptoms of memory loss and confusion would indicate Alzheimer's disease.
Okay. Now, once somebody's diagnosed, what's the treatment process? What do they do for them?
Treatment right now, there are medications that can help slow the process and help with the symptoms. Most common is Aricept, we've been using the longest. There's also Exelon, which comes in pill form or a patch, and Reminil. There's been another one added within the last 4 years, Namenda, that many folks are on. That's something the physician would decide. And they all help to slow the process, improve the symptoms, minimally effective. The best treatment actually is environmental control, understanding the disease, the caregiver helping a person manage their day-to-day life. That's actually more effective, I think, than the medications.
Oh, okay. Now, what are the different stages of dementia?
Different stages of dementia? Well, if you would see someone, Alzheimer's Association uses a stage of early, middle, and late stage.
Okay.
It's very fluid. There's no, in year 1 you're going to have this, in year 5 you're going to have that. It progresses at different times for different individuals. One person, it may be a duration of 20 years. Other folks may be as little as 5 years. It's impossible to predict. It's very individual to the person. There is a saying that if you've seen one person with Alzheimer's, then you've seen one person with Alzheimer's. Because your neighbor has it one way or your aunt had it a certain way does not mean that's the way your loved one
Yeah,
is going to
you
have the
can't
disease.
assume that because somebody goes to work and leaves their parent home or loved one home that has Alzheimer's or dementia, that they're automatically going to run out the door and
Right.
run down the street.
Right, correct.
So let's talk about some of the caregiving issues that can take place. How is it that it would be different if somebody was a caregiver for a dementia patient as opposed to a caregiver for a heart disease patient?
Okay, well, I think the first thing that comes to my mind is duration. Someone with Alzheimer's, it goes on for a very, very long time. It's also hard to understand. The person looks well. They're generally physically healthy,
Yeah.
though they can have other conditions as well, certainly. But it's hard to wrap your mind around. People behave strangely. There's a stigma. Friends go away. It can be very isolating. People don't know what to say. I think the one golden rule is not to argue with the Alzheimer's patient, and people tend to want to reason.
Are there generally more acting out issues or mental issues that you're dealing with that kind of
Well,
person?
there certainly can be, due to the confusion. The person's perception of the world around them has changed, so they may question your motives. They may lose things and think people are stealing from them. And the most likely person would, of course, be the caregiver, because they were the person with the access. They may become suspicious. They may eventually lose memory of who this person is. They may think their son is their husband, or their daughter may become their mother. But it's hard to understand and accept that, and we tend to want to reason with them.
Right.
We want to have them try a little harder. It's confusing because some days are better than others, so it may not be so solid. You think,
Right.
you know,
What
so
works one day might not work the
might
next
not
day.
work the next.
Oh.
And so I think that advice of learning that you can't reason with someone with Alzheimer's disease, because the part of their brain that reasons has been damaged.
So do you want to tell the story about the
Yes,
singing daughter?
yes, that came to mind. Is one of the clients I had in one of my classes had come in saying how difficult it was every morning. She had to go to work, and she had to go to her mother's apartment, get her mother up out of bed, and get her mom to daycare. Every morning her mother did not want to go to daycare, so she was finding every single day she was starting off with a huge argument. Her mom's yelling, she's yelling, they're in tears. So she decided to try something different, to strategize a different way to start their day. So instead of going in and waking her up and, Mom, come on, time to get up, she walked into the room singing.
Singing.
She walked in singing, and she walked around the room, and she would open blinds and just sort of tidy things up, and she would just start singing any little song. And one morning her mother just started laughing. And after that, they began their day laughing. Her mother would start singing along, and so that's how they began their day. Her mother said, told her, you're so goofy to be doing this. And, it became almost a tradition that she continued with her mom until her mom passed away.
Well, singing and laughing, I'm imagining, is better than crying, right?
The most touching comment I think that I've ever gotten from a caregiver taking the course was, thanks for giving me my mom back.
Yeah.
Letting me enjoy my mom again.
Okay, don't get me to start crying,
Okay.
okay?
All right, I'm sorry.
Okay, and just to say one more time, the difference between Alzheimer's disease and dementia.
The
Two
difference
differences.
is that the dementia is the syndrome. Alzheimer's is one cause, one of many causes of dementia, but the most frequent cause.
Okay. Okay, Kelly, you're in the hot seat now.
Okay.
Can you talk about the different programs that you guys oversee?
Definitely. We're fortunate to have many programs and services to reach out to caregivers and individuals with dementia during their journey with dementia. As Diane mentioned, it can go from 5 to 20 years, which is a very long time. One of the key programs that we have is the Savvy Caregiver Program, which is a free 6-week training program for caregivers, basically providing the skills necessary to help them strategize in caring for an individual with dementia. A lot of caregivers are kind of thrown into this without any preparation whatsoever, so this program will help give them some skills to help their days go by a little easier. And again, it is free. Another program we have is the Alzheimer's care teams, which are faith-based teams of volunteers that provide non-medical support and respite to caregivers and individuals with dementia. So a volunteer will come in, they'll take a care partner out for lunch while a caregiver may be going out to run some errands. They may also stay home so that with the individual with dementia, so that a caregiver can do whatever they need to do. I mean, I've also heard stories of when a volunteer comes in that the care partner, the caregiver, and the individual with dementia will stay, and just having someone else there to socialize with, to visit with, is very comforting.
Now, that's coordinated through churches locally?
Through local churches. Right, currently we have 23 care teams.
Okay.
We have 180 volunteers providing care and support, non-medical support, to over 50 families in the region at this point.
Okay, now do they get training beforehand? Or?
We do. We have staff that will provide training for the care teams, and several churches in the area also have several care teams as well.
Okay. All right, next.
We also have many support groups offered throughout the day to try to meet the changing needs and the schedules of our caregivers. We have support groups during the day and in the evening. We have a special support group for adult children caregivers, understanding that they have added pressures of a role reversal, of perhaps caring for their children and their parents, and perhaps even
probably
grandchildren.
working too,
and
right?
working, exactly. And also family dynamics. If there's many children involved, caregiving for a parent, that can present many issues among siblings.
Right.
As I've talked with Diane,
Like
sometimes
who's going to do it?
exactly, and things get thrown back in that may have happened when they were children. So a lot of things, of some unresolved issues, perhaps from childhood, may come out in a time like this. So there's a lot of issues that adult children might be going through at that point.
So that's basically contrasted with like a spouse of somebody that's
exactly.
sick. Okay, but then you probably have a support group for spouses too, right?
We have support groups during the day, and that tends to be the best time for a spouse coming in during a morning or an afternoon support group. A lot of the spouses may be attending a day program. At the Eddy, we have Daybreak, which is a supported day program providing structured activities. At Marjorie Doyle, there's a medical model, so they can also assist with activities of daily living. So sometimes, while the spouse might be at the day program receiving services, the spouse might be able to have the time to go to support group during the day.
Well, that's fabulous. I know that probably a lot of people are wishing their 36-hour days when you have to deal with this kind of issue, right?
Exactly. Every little bit of help.
Okay. All right, next, family forums. You want to talk about those?
Sure. Family forums are a program through our resource center. We run quarterly at this time, providing educational events and informational events on topics related to caregiving and Alzheimer's disease. We've had programs related to the transition of when to realize it might be time to look for alternative placement for someone at home, if it's time when someone is no longer safe at home, and finding a right facility, as well as genetic counseling. And we just recently had an episode with EPIC, the New York State prescription program as well. So, and we're always open to input. Any person can stop by the Resource Center. If there's a topic they're interested in, we'll be happy to research it and try to get a session on that.
Okay. Now, there's another thing I was very interested in was the dementia training program. Can
Yes.
you mention what's done during that program?
Sure. We've been able to go through the virtual dementia tour, which is a program developed by Second Wind Dreams. And basically it'll sensitize caregivers, whether professional or non-professional caregivers, to the issues that someone with dementia is going through, to the sensory issues, and also other issues related to aging in general. So your vision might be impaired. There's some headphones to impair your hearing, and other sensory deficits related to your hands and your feet. And for a brief period of time, which I believe is only 5 minutes, you're kind of thrust into the world of someone with dementia or Alzheimer's disease and what they're living in for 24 hours. And it's very powerful, very stressful coming out of it. You feel very stressed than when you went into it.
Wow. I think I would be too.
Yes, it is. You need some time afterwards to kind of work through some of the issues and the frustrations that you go through in that 5-minute span. It's very powerful.
Okay. Now, we all know that libraries are resource centers, but you also have
Yes,
a resource center.
we do. We have a resource center at Marjorie Doyle in Cohoes, And we have many periodicals. We have DVDs, which family members can certainly come in and borrow. We also have some very talented staff who will work with families. If there's any questions, any needs that they have, we'll be more than happy to help and try to find services in the area that will work for them.
Okay, so if they maybe need a referral for whatever kind of thing,
Sure,
the
we can
Resource
certainly
Center might
guide
be able
them.
to help.
Definitely.
Okay,
Definitely.
in-service opportunities.
In service opportunities, we do provide many opportunities for training with other healthcare organizations as well as within our own organization and other local businesses. Basically a Dementia 101 to kind of give an overview of the disease. Another program called Engaging Residents and working with residents and how to have and how to work with residents and in a formidable.
You get interaction and managing the behaviors environmentally rather than medication.
Exactly.
Than using medication.
Exactly.
Honestly, I
Managing
do
behaviors.
think that in-service, it's got to be expanded out more, I think, than just medical facilities. Because honestly, anyone that deals with the public
Exactly.
needs to know how to deal with somebody with visual impairment, hearing impairment, symptoms of dementia. It can be very challenging.
It can be, and as well as every business might have someone who's caregiving for an individual with dementia. So you might have the issues related to call-ins because someone is caregiving for someone and they can't leave them alone for a certain period of time, perhaps. So there's all various ramifications with that.
Okay, lastly, Cognitive Vitality Series.
The Cognitive Vitality Series is a program geared for healthy older adults at this point and promoting mental health and well-being and cognitive vitality.
Okay, so
Hence the
people
name.
that don't have dementia that want to keep their brains active, right?
Exactly.
Wow, that sounds pretty good, but am I too young for that?
Right now you are.
You have an age requirement for that one?
Yeah.
All right, so that sounds like you're overseeing quite a number of programs, huh?
We touch many people in the Capital District. We're very fortunate.
Okay, Diane,
Yes.
more detail about ADAC, please.
Sure, glad to. ADAC, ADAC is a program that can help families deal with Alzheimer's disease. We provide diagnosis and assessment and home visit to families who are seeing memory loss. Someone may call us, they're seeing the symptoms, they don't know where to turn, or they may have already gotten a diagnosis and don't know what to do next. We can help with that. I go out, I do a home visit, and based on what we find, we provide help with whatever issues they're dealing with. It's hard to say in particular what thing. It might be finding a daycare. It might be helping get home care. It may be further diagnosis with a physician. We have a doctor that works with us, and they come in, they see the doctor, and then they follow up with me when we develop a care plan.
Okay.
It's very comprehensive. It's a 3-step process.
So let's start out with, they come in. What kind of criteria are there for somebody that could be part of that program?
Well, there isn't in particular criteria as much as the need. They call because they need help. They have a person with memory impairment, and they want to find out what's causing the memory impairment.
Okay.
Is this Alzheimer's? Like you said, it's very hard to diagnose in the early stages. Older people tend to have memory loss, and families will say, well, maybe they're just getting older, and after a while, it starts to look like more.
Okay.
So they will call us for clarification.
So if they already have a diagnosis, do they still go and see your geriatrician? Is that part of the process?
They do sometimes as a second opinion, and sometimes they just work with me. But the full 3-step process is a home visit, is a visit with our geriatrician, and a family conference, a caregiving conference afterwards to help plan for future care. That would be the entire ADAC process.
Okay. So lots of different options for future care, obviously, right?
Many options. We will develop the care plan, and I said based on what their need is, if it's a need for home care, if it's a need for daycare, if it's a need for education. We generally try to get the people to go into one of our education programs, to continue with support groups. We have people who have followed with us for 3, 4, even 5 years, have continued. We're sort of the voice at the other end of the phone. They can call us for a quick answer where do we go next, or things have changed and it's time to look for residential placement, and we can help with that. So it could be a variety.
Now, is there special placement for somebody with dementia as opposed to just maybe a general facility?
Yeah, there would be, depending on what level of care they need. We have 2 adult homes that are specific to folks with dementia, Marjorie Dale Rockwell Center and Hawthorne Ridge. There are others in the community as well, and that's a dementia-specific adult home, providing care to people with cognitive impairment. There's that specialty. Within nursing homes, again, depending on where their needs, we do have one of our nursing homes, Eddy Memorial Geriatric Center, has the Courtyard, which is a specialized dementia unit for people at nursing home level of care with dementia. There are a few other nursing homes in the area that have the same.
Okay. And is there a fee for the program?
There is a fee for the program. It's right now it's currently $180, but it's available on a sliding scale. Money is the last reason that anyone should avoid coming in for an assessment, because we can always work with them for payment. And the other thing that's very good news to our Albany County residents is the Albany County has given us a grant, a caregiver grant, that provides for 25 free assessments for folks within Albany County. So we can do the entire process at no cost to them. The exception of the doctor visit, of course, would be covered by their insurance.
Right.
But they have 25 per year that we can offer to residents in Albany County.
Fantastic. Okay, and then you actually teach the Savvy Caregivers program?
Yes.
Okay.
One of my favorite programs. I've been doing that for 6 years now. We've been teaching the Savvy Caregiver through the Capital District. We try to offer one in Albany County, Schenectady, Rensselaer, Saratoga, Warren County, and we'll pretty much go anywhere someone invites us to go.
You're all over the place, huh?
Yes, ADAC actually covers 11 counties.
Oh.
So we do provide services in a pretty wide range. But the Savvy Caregiver program, I do teach. One of the best things I think I can do for families, Kelly outlined it beautifully. The strength of the program, we do teach some skills. We teach caregiver self-care. But most importantly, we teach them how to strategize. It's not a how-to session. My mom won't take a bath, how do I get her to do it? The answer is you don't. You can never convince someone that doesn't want to do something to do that. We teach them to strategize. We teach them to look at this disease and look at the strengths of the individual and not the losses. And so they turn the corner and they realize, yes, they can do this. And that's the strength. We give them sort of a toolbox.
And the thing is, you want them to start learning
Early.
earlier in the process.
Absolutely.
Definitely.
Rather than when they're at their wits' end.
Absolutely.
In a crisis.
Absolutely. I can't tell you how many caregivers have said to me on the comments, the end of the class, I wish I had done this sooner. Everything would have been so much easier. And they see a pretty quick results with some few simple techniques. By the second or third class, they come in and they're very excited because something's worked. And Kelly, you share
Definitely.
one of...
I was fortunate to sit in on one of Diane's recent classes, and there was a gentleman who started the class on the first day, kind of sat separately from everyone else, seemed a little angry, and later on in the course he did admit perhaps he was a little angry. But as the 6-week program went on, gradually he was mingling with other members there on a weekly basis, and at the very end he was probably one of the more verbose. He was communicating and laughing. And he at the very end, he stated, I may not get it right 100 or 50% right.
100% of the time.
Right.
No,
Sorry,
I only
we're
get it
gonna
right
have to edit
50% of the time.
but I'm 100% wiser after taking the class. So that really made an impact.
And that's the power of the Savvy Caregiver class.
And I'm imagining that the people that are taking it are interacting with each other.
They are.
Making
Definitely.
friends.
They are.
They're meeting each other 6 times, so they're going to get to know
They
faces
passed
and
around a
everything
list,
else.
Yes.
collecting phone numbers and addresses.
They're
at
very
the end,
supportive.
staying in contact.
Yeah. So even though they might think, I don't need a support group,
This
that's
shows
kind of like
this shows them
a
the
support
strength.
group.
Well, it is a class, and it's conducted like a class. There's actually homework involved. But while we're supportive, we avoid doing the support group. However, the classes all tend to form their own support group, and they go on knowing each other afterwards, calling each other on the phone, and many of them will attend support groups. We've had them where they form their own support group.
Well, this same gentleman said
Couple of
coming
times.
in, he thought he would never go to a support group, and on the last day he said, you know, I think I'm going to be calling about a support group. I think I realized it's something that I need. So it's very powerful.
Wow. Well, I just have to say that your services in the Capital Region are fabulous. I want to congratulate you.
Thank you very much. Thank you for
Did
having
any
us.
of you, either of you, want to add anything else that you forgot or no?
I don't know. I think, we're covered. I think to reemphasize, call us sooner rather than later.
Yeah. Okay.
Early on, we can help the most.
Okay. All right, and then we're going to do contact information. For further information, the telephone number at Eddy Alzheimer Services.
238-4164.
Okay, and we have a website. Does anyone have that memorized? If not, I
I
have
believe
it
I
written
do.
down.
It's www.northeasthealth.com/Alzheimer Services.
Okay, and the Northeast is NE Health, and it's Alzheimer's
Yes.
Services. Okay, thank you very much for coming in.
Thanks.
Thank you very much for having us.
Thanks for watching. We hope to see you next time on Focus on Health.